We will now move to the Congress closing ceremony. To close the third Asia Pacific Patients Congress, I would like to call on IAPO's Board of Trustees Chair, Dr. Ratna Devi, Board Member and Congress Chair, Karen Alparce-Villanueva, Board Member Orajitt Bumrungskulswat, and IAPO CEO, Kawaldip Sehmi. Now over to you, Karen.
Thank you so much, Kara. And thank you to all our delegates for attending Day 2 of the third Asia Pacific Patients Congress. Our sessions have really been very rich in content, and if I may say, thought-provoking, which has only challenged us to take a deep and meaningful look at our current health system and see and determine whether we want to go back to business as usual or try to transform it to become more compassionate and patient-centered. So we really had excellent moderators, speakers, and facilitators. And allow me to briefly summarize the sessions today and try to capture the highlights of the 4 sessions. So next slide, please. Next slide. So for session 6, we had 3 speakers talking about health literacy in the digital age, both in terms of the benefits they bring and in terms of broadening access to information, but at the same time looking at the challenges it brings in terms of ensuring it resonates with the patients and is understood by everyone. Next slide, please. So in terms of, next slide. So in terms of session 7, we talked about, there were 3 speakers once again, talking about meaningful engagement, moving from tokenism to true patient engagement. And we had very good examples from Taiwan. And we also had Mariko speaking about the Singapore experience. And also Mr. Satoshi from Japan talking about patient and public involvement in Japan. Next slide, please. And then we had a very interesting and indeed one of the newer concepts that we hear today on self-care. We had 3 speakers, and we had our very own Kawaldip Sehmi and Orajitt talking about self-care from the perspective of what's happening globally, and Orajitt talking about the Thailand example and how they have been able to bring self-care into the community. And finally, we had a snapshot of the self-care index study by Consumer Healthcare Products Australia. And indeed, what struck me there was how we're currently incentivizing providers on treating patients rather than allowing them to be self-motivated and in fact educating them for their own good and for them to be able to manage their own condition. And finally, of course, we just had session 9, and our speakers, next slide please. So for section 9, we talked about meaningful patient engagement in HTA and regulatory affairs. And we heard about, again, what Thailand is doing. And another example is from the Philippines, where certainly there are areas to be improved in terms of patient involvement. And finally, I'd like to just take this chance to thank the following people for their support of the Congress. So next slide, please. I'd like to just take this chance to thank once again our co-presenters for this third Asia Pacific Congress, SingHealth Duke NUS, and the Philippine Alliance of Patient Organizations. Thank you very much for co-presenting, and we are very honored and pleased for your support. And of course, we'd like to thank also our sponsors, our gold sponsors led by MSD, Johnson & Johnson, and Viatris, our bronze sponsor, Roche, and our silver sponsor, Roche, and our bronze sponsor, Leo Pharma. And of course, all our partners in mounting this Congress. We have Pin Crowd Events, we have Grupo Sorbetero, and we have TV Style Video. And I'd like to also thank the 50 speakers and moderators and facilitators who have so generously contributed their time and talent and their knowledge and really giving their utmost efforts in ensuring that the content of this Congress will be delivered. And of course, I'd like to thank most especially our host and Master of Ceremonies, Cara Magsanok Alikpala, for superbly hosting our event and really delivering a very professional and very intelligent discourse during the 2 days. And of course, our IAPO and PAPO teams behind us. They've been working so hard, and it's been months that we have been working to deliver a Congress of this magnitude. And of course, all of you, our delegates and our patient advocates, healthcare institutions, healthcare professionals, the academe and students, and of course, the industry and our regulators. Thank you very much for supporting the Third Asia Pacific Congress. And of course, this Congress would not be complete without sharing with you what to expect in the Fourth Asia Pacific Patients Congress. So I have the pleasure to turn over the floor to our next host. Orajitt, the virtual floor is yours.
Thank you, Karen. When you talk about the Fourth Asia Pacific Patient Congress, I think how can I manage this valuable and knowledgeable like this Third Asia Pacific Patient Congress, the next one. So we are in a team. Maybe we have to hand in hand further organize the fourth Asia Pacific Patient Congress in Thailand. So let we talk about that. Where is it? And I think that it should have something scaling up and value added from what we have already paid it in this Third Asia Pacific Patient Congress. I think about it's still there, patient-centric healthcare, and also the transforming of the healthcare to personalized healthcare that I also, we have a valuable speaker, content talk about that, and also the digital health technology for patients. I think this is something that we will try to further and make it strengthening it in the fourth patient Asia Pacific Patient Congress. So next year, right, it will be the post COVID-19 pandemic. And we think that we can have face-to-face to meet each other. Since we miss each other a lot, we can see through the digital technology, like, let's see how we look alike after post-COVID-19 pandemic next year. So come to Thailand, please, and thank you for everyone and our very strong team. See you later. Over to you for Ratna, right?
Thank you, Orajitt, and we can't wait to meet face to face in Thailand. And thank you, Karen, for that wonderful wrapping up of today's session. We had such rich insights, and the Congress would be incomplete if we did not capture these insights into some actionable points. How do we gather these insights into something that our members, our other stakeholders, our partners, everybody can look at and call to action and say that this is what we want to do until we meet next in Thailand for the 4th Asia Pacific Patient Congress. Can I have the slides, please? So just to set the context, the 3rd Asia Pacific Congress has noted that we have wholeheartedly empathized and rallied around patients, families, and communities that have suffered great loss. We all know someone close who has passed away due to COVID-19. The Asia Pacific is going through a once-in-a-lifetime healthcare crisis. The COVID-19 pandemic has exposed great fault lines in our health systems. The pandemic, however, showed us hidden strengths and creativity of our healthcare systems, health workers, and patient organizations in containing and overcoming the pandemic. Next slide, please. Health services in Asia Pacific region have seen great disruption and fall in quality and safety along the full spectrum of healthcare, from health promotion to prevention, treatment, rehabilitation, and palliative care. The Asia Pacific region has many countries now investing in research and development of advanced cutting-edge healthcare technologies. The Asia Pacific region has also discovered that patient, families, and community engagement in healthcare decision-making is critical in improving the effectiveness, efficiency, quality, safety, and equity of health systems and health technologies. It is also noted that it is very important to develop an ecosystem that is accessible to all. Next slide, please. So we have to look at a whole of government and whole of society engagement approach that improves the reach, efficacy, and impact of healthcare. It involves academia and patients working together to develop a new research and healthcare policy agenda. Next slide, please. So our call to action says that the 3rd Asia Pacific Patient Congress now calls upon all WHO Southeast Asia and WHO Western Pacific regional member states, patients, families, industry, and other stakeholder partners to undertake short-term, mid-term, and long-term measures. Next slide, please. Under the short-term measures, we call to action that we bring back focus on Universal Healthcare 2030 agenda, which means we have to invest more in digital health literacy and adopt the syndemic approach to addressing COVID-19 pandemics and any other future pandemics, and the interaction and amplification of biological and social determinants that are so important for the prognosis of such pandemics, their treatment, and healthcare policy. We also call to accelerate the COVID-19 vaccination programs and make them accessible to cover all populations. We must address vaccine equity, and no one is safe until everyone is safe in this region. Next slide, please. To continue with the short-term call to action, we also asked to invest in the research and development of new effective treatments to reduce the heavy mortality and morbidity that the pandemic brought in this region, and to invest in finding treatments for new and emerging diseases and the interplay between environment and health. We also call everyone to support the WHO solidarity trials. Next slide, please. For the midterm measures, we asked to invest and revisit the WHO Compassionate, Integrated, and People-Centered Universal Health Coverage Framework. We asked that patient journeys in a fragmented healthcare system are unsafe, ineffective, and therefore cost more when compared to the integrated health system, and therefore there has to be more investment in integrating health systems vis-a-vis the fragmented ones that we currently live in. We asked to invest in and drive the research and development in digital healthcare in this region. Next slide, please. To continue with midterm, in order to leap forward and invest in genomic medicine and drive research and development and the uptake of personalized healthcare and precision medicine in the region, there has to be more focus on this agenda. We also ask that personalize the full spectrum of health services from health promotion to prevention, treatment, rehabilitation, and palliative care. Next slide, please. For the long-term measures, we ask that there should be effective use of institutions, legislative, policy, practice, and standards frameworks to create an enabling ecosystem for patient engagement and co-creation at all levels of decision-making in our health systems. There should be effective institutional, legislative, policy, practice, and standard framework to institutionalize patient engagement in regulatory and health technology assessment bodies, and to undertake more research and development to provide patient preference studies and real-world evidence to regulatory and health technology assessment bodies in this region. Next slide, please. We also ask that we move to a better mix of self-care and health professional supported healthcare with a focus on chronic non-communicable diseases, aging, and rare diseases, and to amplify digital healthcare and ensure equity and equality by building robust infrastructure for healthcare. We also ask that primary healthcare should be made the bedrock of Universal Health Coverage 2030. Next slide, please. And we also ask that the investment in Global Patient Safety Action Plan 2021-2030 should be ensured, and all member states should focus on this and have robust patient and family engagement institutionalized to eliminate all avoidable patient harm and ensure all patients, families, industry, and other stakeholder partners are committed to the Global Patient Safety Action Plan 2021-2030 to eliminate any avoidable patient harm. Next slide, please. Finally, we resolve to promote, support, and participate in this call to action. Thank you, and I hand over to our CEO, Kawaldip Sehmi.
Thank you very much, Ratna. Thank you very much, everybody who participated today and over the last day. It's a pleasure being in this position that we had such a high uptake of what we were trying to achieve. The region has once again shown its propensity to learn and to share. And I think we are now in safe hands for the future to bring back patient-centered healthcare in the region. This afternoon's workshop is very important for us. We are looking at patient safety and the Global Patient Safety Action Plan and how to bring that about. It's going to be an intense exercise, and we invite those who have been invited to join us. I must go back and say that I must thank the committee profusely. I think you guys really did hard work. I think under Karen's chair, you really went out there and found the speakers that we needed and brought us that diversity and depth of knowledge that we needed. Also, I think from point of view of that compassionate element, I must thank Father Jerry Albers, who really lit the day for the day. That he came in and really broke us free from our traditional medical model of congresses. He brought the human element in it. He brought us that compassionate approach to it. And I liked his humor in that. I think he said, let's concentrate on the humor and not the tumor. And I think he's got his ways of getting across. And I think what I really loved that his approach of that we were all looking for the Good Samaritan. I think the Good Samaritan, as many recall, served diligently without looking at race, caste, creed. To him, the man on the road was someone who needed help, and he bent over and helped him and brought him back to health, whilst the man's own family and clan and had ignored him. So the Good Samaritan in us is very important. I must thank the Philippines again, that your nurses today are the Good Samaritans spread across the world. They're helping us diligently without risk, caste, creed, or other shape. And they're bringing much more humor and much more forethought into it. And with that, I think I will now say that I must thank, firstly, the staff members who joined us from PAPA, our I9s. I think you guys have been really good, learned a lot from this. again, my own staff member, we've got Rachel and Danny, who have been sleepless over the last few days. I think I've checked some of the WhatsApp messages, and they're coming in at very early in the morning, 1:20. So we've been up quite early. So you guys deserve a good break. Traditionally, when we had face-to-face, we would all meet up at a restaurant, but because of that, I think we will avoid that. We will do other ways. And lastly, I think our sponsors who really put so late in the day of the year, I think they still dug deep into their pockets and found something for us to use. And as I always say, we always use the funds wisely and effectively. And we make sure that we are building a coffer up for Global Patients Congress in Geneva next year, around about May. And then we have got a full program to deliver next year, within which we have got some heavy elements that we need investment in driving that change. And clearly, the Asia Pacific region is now in very stable condition to drive those changes through. I would, as a final mark, I would once again, as is usual custom, open the floor to Karen, Orajitt, and Ratna. If you have to say anything, here's your last word, and then we all break for the next session.
My
Karen,
last word is a big heartfelt thank you.
Thank you for your leadership also, Kawaldip. Thank you.
Okay. Thank you.
Island is okay, safe, and then we can see each other as well.
Thank you much.
Thank you, everyone. Bye-bye.
Okay. Thank you much. And please join us with the other link for the workshops, and we'll take it over from there. Thank you very much.